Hi, I'm William Everden, one of the doctors at Poole Hospital, which is one of 2 hospitals in the University of Hospitals Dorset Trust. I did a project alongside Shona Main, Elizabeth Walsh and Lucy Rigg, and our project is titled Improving Patient Care and Safety in the Management of Pneumothoraces. So a non-traumatic pneumothorax is a very common acute presentation to secondary care. Some of these patients require procedural intervention with the insertion of either a chest drain or a pleural aspiration. These are obviously invasive procedures with serious established risks and are currently performed by the respiratory team, acute medical team, critical care, radiology and emergency medical teams across both hospitals. The objective of our project was to improve the management of patients presenting to Poole Hospital with a spontaneous pneumothorax and making sure that our trust is complying with the British Thoracic Society's guidelines. These guidelines include, firstly, patients should receive appropriate initial treatment, either conservative or interventional. Patients should receive advice and safety information, and they should receive timely follow-up within 2 to 4 weeks. Secondly, pleural procedural documentation and formal consent should maintain the expected standards. And thirdly, patients requiring intervention should receive review from a respiratory physician within 24 hours. To assess whether there was a problem, we performed an initial audit of patients with pneumothorax over a 2-month period. Underlying pathology, intervention appropriateness, documented advice, location of procedure, presence of written consent, and whether any follow-up was arranged was recorded from scanned records. Procedure documentation was also reviewed in terms of standard. A total of 53 patients were suitable and therefore included. The results from the audit revealed the following. So if you refer to the first graph, whilst we performed the appropriate intervention on 100% of patients, we were otherwise not hitting the same standards as per the British Thoracic Society's guidelines, with patients not receiving appropriate advice and information, with most patients not receiving appropriate follow-up within 2 to 4 weeks, and overall documentation was poor. Referring to the second graph, it also shows there is a clear lack of standardised pathway for pneumothorax patients throughout our trust, with the graph highlighting multiple departments responsible for arranging follow-up. Review of this data revealed 3 clear problems that needed addressing. Firstly, a lack of consistency. There was no clear agreement on a pathway or a department responsible for follow-up of patients presenting with a pneumothorax. Secondly, lack of information. Not all patients received the appropriate advice or guidance. There was poor documentation of consent and the procedure process by physicians in the notes, with different paperwork being used in each department. And finally, lack of follow-up. More than 20% of patients were not being followed up at all. So how do we go about improving this? The next step was creating our interventions, and they were targeted at the 3 areas I just discussed. All our interventions were circulated around the key medical teams involved to allow them time to provide feedback and revisions prior to circulation. We created a patient information leaflet which covered information regarding pneumothoraces as well as the BTS required advice on pneumothoraces. This can be given to all patients who present with a pneumothorax and is available upon our trust. A new standardised LOCSIP insertion checklist has been implemented with a documentation form on the reverse. Again, this is all available on the internet alongside the patient information leaflet and is in chest drain packs which are in the emergency department. And finally, a new streamlined referral pathway was agreed upon between all departments. This covers both the initial respiratory review and also arranges follow-up. So the next step moving forwards, already all departments have commented on the benefits of the clear pathway and our interventions. These interventions are currently being utilised across both hospitals in the trust. After 2 months, we will repeat data collection following introduction of the interventions to formally measure their success. We've already seen documents and use in patient notes and therefore expecting very positive results. Thank you for listening to this video presentation, and I hope you found it interesting and learned something from it.